Okay, my name is Jacob, and this is going to be my subcutaneous injection and my intradermal injection. So the first thing I'm going to do is I'm going to go to my patient's chart. I'm going to look at my patient's chart, know that I have a medication due at this time. I'm going to note for any allergies on my patient's chart. Then I'm going to get the original doctor's orders and compare the original chart with my MAR. So then once I know that I have that and everything works out, I'm then going to go to my medication cart, perform hand hygiene. And then the first thing I'm going to do is I've gathered all my supplies first. I've brought them over. I've checked the integrity of the packages, checked the expiration date, and everything's good on that. So then I'm going to open up my drug cart. I know I have the right patient. And it's important to know for each medication that you withdraw, it's important to know the allergies, the effects of the medication, the adverse effects of the medication, the purpose of the medication, and if there's any special nursing assessments that I need to make for the medication before I administer it. So the first one I'm going to do is I'm going to check. I know I have the right patient. The patient's there in his room because it's the right time. I check that first, and then I check the medication as I'm withdrawing it. That's my first check. So I need to know that I have a vial. I've checked the expiration date. That's good. And I've checked that, and I'm also doing the 5 rights. So I have the right time, route, dose, and medication. So that works out. The next medication I'm going down the list is this one. It's by an ampule. So I have drug X from an ampule, and that is the right medication. So I have withdrawn my medication. So now I can do my second check, which is administering. First I'm going to do the ampule. So I have my 3 milliliter syringe. I've already done my appropriate drug dose calculations, making sure that they're in the safe dose range, because I don't want to harm my patient. So I have that. And then for an ampule, you'll need a filter needle. So I'm going to attach my filter needle. Get that ready. Okay, so I know how much the amount, which is half a milliliter with an ampule. So then I need to open my ampule. This is part of my second check. I'm making sure that I have the second check, the right medication, the right time, route, dose, and medication once again, along with the second check. And I need to open the ampule, make sure all the fluid's down in the base, and then wrap a little piece of gauze on it, and then you just give it a little crack, opening this away from me. Crack that open. That goes in the sharps container. Okay. And then I need to withdraw my medication. So I use a filter needle going right inside, not touching the base. I'm going to withdraw my medication without aspiration, with a little bit extra for any air bubbles. Draw that. Okay. Okay, get all my air bubbles out of this. And then I'm going to move the bubbles out. Let's just put one more on the side there. Alright, and then move the plunger up to the right dosage. There we go. Got it. And then I need to take my filter needle off. I'm going to scoop that up and then put that in the disposal. And then I have the right medication upon the second check. So now this is extra, and I double checked it along with the second check and the 5 rights, and then I'm going to do the third check on this, make sure I have the proper medication that I administered from the vial, and I am then going to make sure I have the 5 rights, time, route, dose, medication, patient, and then I'm going to dispose of this because I don't want glass out. So that's my third and final check, and then I'll get rid of that. And then for my also, I need to attach my needle for my subcutaneous, which I'm going to be using a 26 gauge, 3/8 inch needle. So I'm just going to go ahead and put that on there. So I have that one. So that medication's all done. My next medication going down the list, second check. The expiration date is good. And doing the same time, route, dose, medication, patient, and the right medication, so we're all good. So then I need to do that. I have my intradermal medication. Alright, there's my alcohol. Do that on the top. Good. And now I need to aspirate I have the right, this is my second check, so I did the second check in the 5 rights, time, route, dose, medication, and patient. I need 0.25 milliliters of this medication, so I'm going to aspirate a little bit more air in there, uncap it. And then for this medication, I would stab it and then put my air in there, flip it upside down, and then withdraw my medication. But for this medication, because it is an intradermal, I have to use air on the specialized pouch. So I'm just going to withdraw 0.25 ml of air, or the medication for this, and then use a scoop technique. So now I have my 2 medications that I've prepared. I'm going to do my third check on my second medication. It is the right medication, it's the right time, route, dose, medication, and patient. I'm then going to be putting it away. So as my third and final check, I only need to do 2 of these. So then I'm going to lock this puppy up. So I have that. I'm going to clean up all of my supplies. All this is garbage. Okay. And then I am now ready to go to my patient's room. So I have the MAR. I'm going to need a few alcohol pads, alcohol swabs. I need a couple gauzes. So I'm going to take my medication, not leaving it out of my sight at all, in my MAR. I'm going to go to my patient's room. I have my medication. Go to my patient's room, knock. Once I enter the room, I'm going to say, hello, my name is Jacob. I'm a student nurse from Madison College. And your name, full name and date of birth is? Okay, that is exactly who I'm dealing with on my MAR. I'm also going to check your wristband. Okay, check the wristband, and it is the same person. So then I'm going to tell you that I need to give you subcutaneous and intradermal injection. And I'm going to explain the reason why, the purpose of this medication, and make sure they know about any adverse effects of this medication, and making sure that they are compliant with the medication. And they are. So then I'm going to say, okay, the first thing I want to do is I'm going to do an intradermal on you. Okay. So then for site finding, I'm going to find the anterior portion of the arm, 4 fingers in between, right in that spot, right about there, is where I'm going to administer that medication. So I'm going to be using this specialized pad to do it. So once I do that, I'm going to be putting on my gloves. Putting on gloves that actually won't rip. Okay. So I need to do an alcohol prep on this. So I do that. So this is on the forearm. I've already showed you site finding, so I'm going to do the circle moving outward. I'll move this a little closer so you can see. Circle moving outward, okay. And then with my intradermal, I'm going to undo that. So the bevel is up, and then I'm going to make sure, I'm going to spread the skin so it's nice and taut, and then I'm going to just slide the bevel right underneath the skin, make sure the skin is taut, and then I'm going to stabilize, and then slowly inject the medication underneath the skin, and should be able to see a wheal form. Just a little bit one there. So there's that, and I'm going to slide the needle out. Alright, so there should be a wheal form there. This is going to go in my sharps container right away, but I'm going to cap it. So then after that, I'm going to, if there's any other kind of medication that's seeping out, I would take my gauze and just kind of wipe that away, applying no pressure whatsoever. Alright, and then for my second medication, I need to do a subcutaneous one. So then, providing for privacy, I know they have an abdominal wound, but I want to go to the side of the wound. So finding this site, I would use 2 inches away from the umbilicus, above the belt line, or in the fatty portion of the medial portion of the abdomen here. I would find that little fatty portion right there. And then I would do the same thing for that. I would need to clean it with an alcohol prep. Starting from the center, work my way outward, clean that up. And then for this one, I need to give it a little squeeze there so I can make sure I get into the subcutaneous. And then a 45 to 90 degree angle, I'm going to use a dart-like motion, put it in, release, stabilize, and then slowly inject my medication in there, 1 ml per 10 seconds, then release. Okay, and then this goes immediately in my sharps container. Let's do a little quick cap on that because I need that. So then after that, if there's any other kind of medication, I would just apply very light pressure and just kind of make sure there's all the medication's done. So then after that, move my table a little out of the way here. So then I would dispose my gloves. I would immediately chart on my MAR that I've administered this medication. All right. I would make sure my patient is comfortable, right, for privacy. put the bed in the lowest possible position, making sure to document the time and the appropriateness of the medication. I would also come back later and assess the patient for the effectiveness of the medication. I would also see if they need any other kind of needs or any kind of any other thing that they needed. I would also make sure the call light is within reach. There they go. And then I would document later about the effectiveness of the medication and making sure the patient is okay. And that concludes my video.